The holiday decorations are coming down. There's no longer an endless supply of cookies and chocolate in my kitchen. It's basically that time of year when I like to treat myself to a little something special, or maybe a few little somethings special, which is where Quince comes in. Because Quince partners directly with manufacturers, they're able to pass their savings on to you, so you can get luxurious clothing and accessories at prices that are 50 to 80% less than similar brands. Now, I've got my eye on a couple of things that I think will go a long way toward brightening my winter mood. One is a dolman sleeve cashmere sweater that's priced at just under $40. And the other is a lightweight puffer jacket that's just $79.90 that I plan to take with me for some hiking in Sedona in a few weeks. Treat yourself this winter without the luxury price tag. Go to quince.com/nursemo for 365-day returns plus free shipping on your order. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips to help you thrive in nursing school and at the bedside. Before we hop into today's topic, which is a maternal newborn topic, let's take a quick minute for a listener shout out. This one goes out to Chris, who says, "I've been looking for this since I started nursing school. It's exactly what I needed." Mo covers the topics you need to learn with plenty of practical tips and awesome pod quiz reviews. I love listening while I'm getting school lunches together, cleaning, and best of all, out for a walk. Thank you, Nurse Mo. Well, thank you, Chris, for taking time to share your feedback about the podcast and how it is helping you. And I love that you enjoy the pod quizzes. For anyone who also loves the pod quizzes, you owe it to yourself to check out my private podcast called Study Sesh, which is mainly made up of entire episodes of pod quizzes on a ton of different topics. I'll put a link to Study Sesh in the episode notes. So let's hop into neonatal hypoglycemia. And this is a condition in which the newborn child has a low blood glucose level. Now, because glucose is the brain's primary source of energy, this condition must be recognized quickly and treatment promptly initiated to avoid long-term complications. And interesting to note that it is the most common metabolic disturbance in newborns. Now, before we get into the weeds of this topic, let's go through a few key terms. We'll talk about glycogen, gluconeogenesis, and glycogenolysis. So glycogen is simply the stored form of glucose in the body. And then gluconeogenesis is the process of creating glucose from components found in non-carbohydrate sources like fats and proteins. And then glycogenolysis is the process by which glycogen is broken down into glucose. So we'll be talking about these things as we discuss neonatal hypoglycemia. And let's start with pathophysiology. So looking at normal physiology, the fetus receives a continuous supply of glucose from the mother and does not have to rely on synthesis of glucose for survival. But once the fetus is delivered and the umbilical cord is cut, gluconeogenesis, glycogenolysis, and feeding are required in order to maintain adequate blood glucose levels in that newborn. Now, it's important to note that even healthy infants can experience temporary hypoglycemia as they adapt to life outside of the womb. In those healthy infants, this transient hypoglycemia is often very brief and usually causes no symptoms. Where we get into trouble is with really low levels in babies who are really high risk for hypoglycemia and in persistent hypoglycemia that's causing symptoms. So let's talk about some risk factors for prolonged neonatal hypoglycemia. Now again, though many infants do experience a drop in blood glucose as they transition to what we call extrauterine life, or life outside the uterus or life outside the womb, some infants are at higher risk for more significant hypoglycemia or more prolonged hypoglycemia. And this includes infants born to diabetic mothers, late-term infants, large for gestational age infants, and then on the flip side of that, preterm infants, small for gestational age infants, infants who experienced intrauterine growth restriction, infants who've experienced any kind of stress in the perinatal period, and infants whose mothers receive certain medications in that intrapartum period, such as terbutaline or labetalol. Okay, so those are going to be the infants that are at risk for prolonged or significant hypoglycemia. So let's talk a little bit more about this. Infants born to diabetic mothers and infants who are late term or large for gestational age are at higher risk for hypoglycemia due to fetal hyperinsulinism and increased peripheral glucose metabolism. So again, that was infants born to diabetic mothers, and infants who are late term or large for gestational age are going to be at higher risk for hypoglycemia due to fetal hyperinsulinism and increased peripheral glucose metabolism. So prolonged maternal glucose levels lead to fetal hyperglycemia. So mom's got high blood glucose, now the fetus has high blood glucose. And this causes the fetal pancreas to produce more insulin. So this elevated level of insulin persists even after the child is born, resulting in hypoglycemia. In addition, infants born to diabetic mothers are not able to sufficiently mobilize glycogen stores after they are born, which further exacerbates the low blood glucose levels. Now, small for gestational age infants, as well as those who are preterm and those who experienced intrauterine growth restriction, are at higher risk for hypoglycemia because they are born with reduced glycogen stores. They have increased metabolic demands relative to their large brain size, and they have decreased adipose tissue. In addition, very low birth weight infants have lower levels of enzymes that are involved in gluconeogenesis. Now, infants who experience stress in that intrapartum period or perinatal period are at higher risk for hypoglycemia due to increased metabolic demands that can persist for weeks. Some causes of stress include preeclampsia or eclampsia, fetal distress, infection in the mother, and neonatal hypothermia, among others. Those are just a few. So why do we care so much about neonatal hypoglycemia? Well, when this low blood glucose level is prolonged, the infant can actually suffer devastating consequences. Remember, the primary energy source for the brain is glucose. So if we deprive the brain of its energy source, some really devastating things can happen. This includes long-term neurodevelopmental disabilities, cerebral palsy can occur, brain damage can occur, and even death can occur. So absolutely devastating consequences. So now that you've got some background information about neonatal hypoglycemia, let's go through the key things you need to know using the straight A nursing latte method. So that first letter in the latte method is an L, and that stands for look. How does the patient look? Basically, what are their signs and symptoms? So while some infants will have transient hypoglycemia that causes no symptoms, it's really, really important to know what symptoms we're going to be on the lookout for so that we can have this high index of suspicion that that child's in trouble and needs supplemental glucose. So some key symptoms to be watching for include irritability and tremors, lethargy or coma. The patient could even be in a coma, unarousable, You could see respiratory issues like tachypnea, grunting, which is always a very bad sign in a child, periods of apnea, and even cyanosis, that bluish tinge to the skin. The child could have a high-pitched or weak cry. They could have hypotonia. They could even have seizures. They could have hypothermia, which is a low body temperature, difficulty feeding, and sweating. So those are some symptoms, signs and symptoms that you'd want to be watching for that could indicate your baby that you're taking care of has hypoglycemia. So the next letter in the latte method is an A, and that stands for assessment. How are we going to assess this little patient? So the most important assessment is basically to know which infants are at highest risk for hypoglycemia, since blood glucose testing is not done routinely on all newborns. Much of this information can be obtained from the chart, or you could also interview the mother, asking her questions about her health history if there's not a lot of information in the chart. But usually you're going to know which babies are at high risk for hypoglycemia. You also want to observe all of these little children for signs and symptoms of hypoglycemia, especially, again, those who are at higher risk. Pay particular attention to signs of lethargy, seizure activity, hypothermia, or jitteriness, as these are common signs of hypoglycemia. In addition, you also want to assess the infant's feeding patterns, their suck strength, their ability to latch, and their duration of feeding. Now, if the child is receiving formula, you will also be monitoring volume of formula that they've had to ensure the child is receiving adequate exogenous glucose from the formula. Because remember, the child needs to get glucose in some ways, and one of those ways is from feeding. So delayed or inadequate feeding can precipitate or exacerbate hypoglycemia. All right, the next letter in the latte method is a T, and that is for tests. How are we going to test this infant? Let's take a quick break, and then we'll come back and talk about that. When it comes to grocery shopping and meal planning, I've got a little bit of a problem. I am terrible at meal planning. Instead, I get inspired by recipes I see online, spend a ton of money, and struggle through overly complicated meal prep. But all that's about to change thanks to Hungryroot. Hungryroot is like having your own personal shopper and nutritionist. I just told them about my goals and preferences, and they filled my cart with personalized recommendations. And here's the part I love the most. All of Hungryroot's recipes can be made in just 15 minutes or less. I'm super excited about my upcoming delivery. All the recipes look absolutely delicious, but I'm especially excited to try the zesty cauliflower tacos on almond flour tortillas. Plus, they also have smoothies, ready-to-eat meals, and salad kits. My life just got a whole lot easier. You're going to love Hungryroot as much as I do. Take advantage of this exclusive offer. For a limited time, get 40% off your first box, plus get a free item in every box for life. Go to hungryroot.com/nursemo and use code nursemo. That's hungryroot.com/nursemo, code nursemo to get 40% off your first box and a free item of your choice for life. hungryroot.com/nursemo, code nursemo. So looking at the first T in the latte method for testing, the key test utilized is the blood glucose level. This is done via a heel prick blood test. So we prick the infant's tiny little heel and get a drop of blood from that. And we will use the bedside glucometer to test that blood sample. Now, sometimes in severe cases, the blood glucose level is going to be lower than the glucometer can read, and that happens in adults as well. When the blood glucose is really low, the glucometer will just say low. And that's when you start to panic a little bit because you have no idea how low it is. You just know it's critically, critically low. When this occurs, a lab draw will be utilized to get that exact blood glucose level. Now, the infant will require repeated blood glucose testing until the hypoglycemia has resolved and the child is consistently maintaining an adequate blood glucose level. Now, some other tests that may be utilized in serious or prolonged cases include some labs like insulin level, cortisol level, growth hormone level, and glucagon level. These could be drawn to determine any underlying endocrine-related causes for the hypoglycemia. Lactate and ketone levels may also be done to evaluate metabolic status. Now, ketones will tend to be present if the infant is using alternative sources of energy when those blood glucose levels are low. We could also get an arterial blood gas on this little one. An ABG or arterial blood gas can assess for metabolic acidosis in cases of prolonged hypoglycemia, and an infection workup may be needed. If infection is suspected as a cause for the hypoglycemia, tests could include a CBC. Basically, we're looking at the white blood cell count, the white blood cell differential, and blood cultures as needed. And then imaging may be done. If neurological damage is suspected, an MRI or CT scan of the brain could be done. Alrighty, the next letter in the latte method is a T for treatments. How are we going to help this little one? Now, it's important to note that protocols can vary and obviously do vary from one facility to another. So, speaking very generally, infants with blood glucose levels less than 40 milligrams per deciliter require prompt treatment to restore adequate blood glucose levels. So, treatments generally include, first off, glucose gel, which is administered buccally or in the cheek so that it can absorb there. This is often the first intervention unless levels are critically low and significantly low and dangerous. So for those more dangerously low levels, IV dextrose is administered as a bolus followed by a continuous dextrose infusion with the goal of maintaining blood glucose levels between about 40 and 50 milligrams per deciliter. Now, infants who do require IV dextrose will be admitted to the neonatal intensive care unit for very, very close monitoring. You could also see corticosteroids used, which increase blood glucose levels by decreasing peripheral utilization of glucose. And you could also see glucagon, which is a hormone that stimulates glucose production. Now, in addition to these pharmacologic treatments, some other key treatments include early feeding, ideally within the first hour of life, and increased feeding frequency. Now, some infants may have difficulty breastfeeding due to latching difficulties or poor sucking ability, so they may need supplementation with formula. And for these little ones that are having difficulty breastfeeding, a lactation consultant can be really, really helpful. Now, that final letter in the latte method is an E, and that stands for education. What education is provided to the parents of this little one? Very important here to understand that any abnormality in a newborn is going to be a significant cause of stress and concern for the parents. You can really do a lot to lessen this burden by communicating all assessments and interventions in an easy to understand and calm way. So some key things to teach include, let's teach the parents what a normal blood glucose level is and keep them apprised of the infant's levels as we test them. You also want to educate the parents on the things you're watching for that would alert you to symptomatic hypoglycemia. This can also ensure the parents know to alert you if they notice any of these signs. You also want to teach why it's so important to check blood glucose frequently. Since this does require a heel stick each time, new parents may fear their child is being put through a stressful or painful experience, especially if the little one's crying. That's very distressing. Assure the parents that this testing is done for their child's safety. You also want to teach the parents how often the infant should be feeding and how much intake is adequate. You can also share tips for successful breastfeeding and, if using formula, how to reconstitute the formula. And you also want to ensure they know how to measure the child's intake. This is either going to be done through the amount of time breastfeeding or the volume of formula or bottle-fed breast milk that the child receives. So there you have it, your quick overview of neonatal hypoglycemia. I hope it's helped you feel more confident should you face this situation in the clinical setting or even just on a nursing school exam. For more lessons on maternal newborn topics, I will put a link in the episode notes so that you can go straight to a summary list of everything I've ever talked about that involves topic of maternal and newborn nursing. So I will hopefully see you back here very soon. Let's see what I've got coming up on the podcast. I've got a special bonus episode coming up soon if you're a new student, or not even a new student, but like at the very, very beginnings of your nursing school exploration. It's going to be absolutely fantastic, so keep an eye out for that. And I've got some really great Mo's Monday Minute episodes coming up that I can't wait to share with you. So I'll see you back here very soon for more of the Straight A Nursing Podcast. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Have you ever wondered what the science says about certain foods, products, or treatments? Does chiropractic actually work? Should I only buy organic foods? Are GMOs actually harmful? Is adrenal fatigue real?
We've got you covered. The goal of the Unbiased Science podcast is to dispel misinformation and misconceptions across an array of science and public health topics. We love to debunk myths and help arm our listeners with information so they can make evidence-based decisions. Make sure to tune in to the Unbiased Science podcast to get all of your questions answered.